The topic of this presentation is to find an answer about short stems and the role in the world of arthroplasty. Is it just a hype or a real advantage? When I was asked to bring a representative case for optimists, I took this one. Let's go back to year 2010. It was a 55-year-old male presenting with a bilateral severe osteoarthritis, with an attitude, performing active sports, tennis and golf, and he was in an excellent general state of health, no risk factors, no diseases. So at this point of time, I had experience with one-stage bilateral operation. I had experience with arm vitamins press fit cup. I had experience with so-called short stems. But this particular case is my first one-stage bilateral case where I implanted an arm vitamins press fit cup and a cementless short stem. I followed up this patient very strictly, and this is the 10-year follow-up. He performs still painless his sports. He has an excellent reconstruction of center of rotation, leg length, and femoral offset. If you look a little bit closer to the interface of the implants for the cup and the stem as well, you can see there's a really good osseous integration, and we do not see these findings which we sometimes know from some particular straight stems like stress shielding or osteolysis. So what is my definition of a short stem? I think compared to traditional straight stems, the orientation and the positioning of the stem is not in line to the diaphyseal axis, but to the calcar. It's a calcar-guided orientation. For varus hips means that you will be able, independent of the femoral neck resection, to perform a little bit more varus positioning of the stem, and for valgus hips you will be able to perform a little bit more valgus positioning of the stem. And these provides a precise anatomical reconstruction with center of rotation, femoral offset, and leg length as well. If you look a little bit closer to this particular stem, the main characteristic, you see medially the anatomical curve to achieve a perfect fit along the calcar arch. It's a cementless anchoring with a titanium plasma sprayed and calcium phosphate coating. And if you see on the right side the shape of the diameter, it's a triple tapered design which provides an excellent high primary stability. Besides this, we have 12 sizes available. Each size in monoblock option as a standard option or a lateralized option. And if you are in an XXL situation in the future, you will be able to order by the company some size 13 or 14. Or for XXS situations, there will be able to order some so-called dysplastic design stems. And the particular advantage of this technique is to work pretty good with minimal invasive procedure, and the main difference compared to traditional straight stems, especially for Zweimüller stem example, is that you do not have to attach the pelvitrochanteric muscle insertions like gluteus medius and obturator muscle. And if you look on the left side, the lateral hook has to be positioned not inside or laterally of the greater trochanter in the muscle, but at the lateral border of the femoral neck osteotomy. So this is a very easy and less invasive implantation technique. In Germany, we have a really growing up arthroplasty register. And if you focus on the report of the year 2020, we can see some key facts on the left side. Cementless arthroplasty is a most favorized technique with nearly 80%. Ceramic heads are used with nearly 90%. Head sizes are growing up. 36 millimeter has a part of almost 40%. But another fact which we can pretty good see here is the number of short stems is growing up year for year. And if you look if you have a look in the text of the analysis of this report, we can see that both immediately after the primary procedure and over the current follow-up period of 5 years, especially short stem prostheses show in the arthroplasty register of Germany a lower probability of failure compared to cementless stems, cementless straight stems. So what does it mean in detail? You can see it here. Here are 90,000 prostheses, traditional straight stem matched versus short stem. Straight stem is the orange line, short stem is the blue line. The number of short stem was 20,000, and you can see really clearly that from the beginning the probability of failure is significantly lower compared to traditional straight stems. And if you take a closer look to the combination of arm press fit Vitamist cup with Optimist cup, there are already about 6,000 combinations like this now in the arthroplasty register. You can see that there is a revision rate of 1.5% in the beginning, but it will not increase much for the next following 4 years. So after 5 years, we are in a revision rate with 1.8, and compared to other combinations, this is really an excellent result. Besides the general report, we receive a so-called individual hospital report as well. So we are, of course, developer clinic a little bit of short stem, and if we talk about cementless stem, we talk about short stem and all. So our statistics for cementless stem is 100% Kalka-guided Optimist stem. And as you can see, our analysis of revision for all reason is not only below average, and it's even below standard deviation. So that's a really good result. If we differentiate the reasons for revision, exampling here for infection, we are below expectations as well. Besides these very good register data, we have some clinical surveillance studies running with more than 800 cases, and my colleague Philipp Kutzner has already published these 5 years result, and you can see the patient satisfaction and the Harris Hip score achieve perfect and excellent results after 5 years. So what does it mean in conclusion? Short stems are able to cover a really good range of indications. They are able to reconstruct the anatomy, and we have a growing up excellent clinical study and register data. For my personal experience, limitation is severe osteoporosis, for example, door type C stem femoral anatomy. In this situation, I would prefer a cemented fixation. You can see it on the picture right on the side. And for severe dysplastic situation or valgus situation with CCD angles above 140, 150 degrees, I would prefer to perform a lower osteotomy in combination with a traditional straight stem, for example, choral design. So, is it a hype? If you look to Oxford language definition, what does it mean, a hype? It's a particular, spectacular, rousing advertising which causes euphoric enthusiasm for a product. For my opinion, for my experience, and I think for the experience of the arthroplasty register as well, it's not just a hype. We have a good indication for minimal invasive surgery. We have a bone and muscle preserving technique. We have a simple technique to insert the stem. We have lower blood loss. We have short operation times, and we have an anatomical reconstruction. I have only 10 minutes time, but there are a lot of studies existing already about these facts. So you have a potential for improvement of quality measurement and individual register data. Thank you very much for attendance.